So, Assalamu alaikum, everyone. Eid Mubarak. So, I don't want to waste a lot of time today because it's going to be a long session. And I will make sure that we get more hands-on experience. So, please, let's use the chat function if you guys have any questions. And feel free to ask questions anytime. I will keep an eye on the chat. If you want to raise hand, that's fine. Mohsen, if you can, allow them to talk, then, they can jump in and they can ask questions. I'm hoping that we will do more sort of hands-on session where you guys will be actively, seeing how things are being done rather than more of a lecture base. So let me share my screen. So, and because of Eid and everything, I took pieces. So can everyone see my slide set? Okay, good. So let's go to slideshow. So today we're going to talk about systematic reviews and meta-analysis is just part of the heading, but we'll be only covering systematic reviews. I'm hoping that in future we can do a meta-analysis piece too. You guys know my name is Sadiq Naveed. Okay, so what we will be covering, we're going to talk about different types of studies. We'll talk about differences between different types of reviews. And then we will go through steps of the systematic reviews that are being done during a systematic review. So why systematic reviews are important, for certain reasons. If you look at this hierarchy of evidence, you can see systematic reviews are on the top. And it is on the top because of its rigorous methodology and also because there is a higher emphasis on eliminating bias. So when I look at, review articles, in my opinion, I can divide them into certain types. So on the top, you will see systematic reviews and then scoping reviews. And then at the bottom, you see narrative literature reviews, opinion articles, commentaries, and letter to editors. Now, commentaries and letter to editors are not really the review article, but they are sort of, an opinion piece, insight into the knowledge, things like that. Now, in last topic, last webinar, we did talk about different types of studies. So I just want to talk a little bit more about that because for you guys to know about systematic reviews, you guys, when you will be retrieving articles, for each question that you're going to pose, there are certain types of the studies that needs to be considered. Let me see. Okay. So there are two basic type of studies. One is experimental studies, and second one is observational studies. In experimental studies, just remember there is some sort of intervention that is happening, some sort of treatment, or and by treatment I don't mean only medications. It can be any sort of interventions that is taking place. Now, these can be divided into two broader categories. One is called randomized controlled trials, which means that there is randomization. Another one is called non-randomized controlled trials. By randomization is meant as, let's say if we have 10 participants in a study, they are randomized by certain ways into, let's say, 2 groups or 3 groups. In non-randomized controlled trials, they can be open label trials, where participants know what they're getting, and they're not randomization methods that are used to assign participants among different groups. Then there are observational studies. So in observational studies, there is no intervention that is involved. It's usually you let the study run its course, and then you look at the patterns and analysis and go from there. So there are different types. One is called cohort studies. Last session, we did talk about retrospective cohort. And then there are case control studies, and then cross-sectional studies and ecological studies. Ecological studies are usually done at population level, where you compare different bigger groups. Now, what is the difference between cohort studies, case control studies, and cross-sectional studies? Just remember, in cross-sectional studies, they are done at the time and the moment. So let's say if you want to look at prevalence of depression in city of Lahore, I go to 500 people, I get the prevalence data right in that moment. They answer me that question about, let's say I do PHQ-9, they answer the question. That would be more sort of cross-sectional study. In cohort study, is a longitudinal study. So you start with an exposure, and then you track those participants over time when there's an outcome. So just to give an example, you track people who are smoking cigarettes, and you want to see over the period of time whether they will develop lung cancer or not. So that's a cohort study. Then there is case control study. As the name suggests, that there are cases and there are controls. So there are cases, for example, who have lung cancer, and there are patients who don't have lung cancer. And you go back in time, you get history from them, and see if they have smoked in the past. So you want to see if there is an association between smoking and lung cancer. So that's the case control study. An ecological study, as I mentioned, is on population-based study. This is a really nice diagram. If you look at this, sort of representation of a human being, so they are comparing that group, and the patients already, or individuals already have disease, or they don't have disease. You can see those bolded circles and non-bolded circles. So what you do is you go back in time and you see if they have, what kind of exposures they have, what kind of risk factors they have. So that's your case control study. Now, the next one is your cohort study. So in this, you track people who are exposed to certain risk factors, and you track them in future in time. So see, there is a disease with the question marks, and you track them on time and see what kind of illnesses they're at high risk of, right? So this is your cohort study. Now, retrospective cohort study, which is at very bottom. So see, the man here is right at the end of the time. So they reach out to people who, so for example, I want to look at, same example, I want to look at smoking and lung cancer association, right? I have this data that Mohsin conducted a study, and he looked at the lung cancer and occupational hazard, right? Asbestos. He has this data that he collected from 2005 to 2022. And I asked him, okay, let's look at, whether those patients who were smoking, whether they are at risk, whether smoking can increase the risk of lung cancer, right? So the time it goes back in the time, but what you do is you pick, divide groups based on people who smoked and who did not smoke, and you go back forward in time and see if they develop the disease. So that's what it is called by retrospective cohort. So the name suggests retrospective, that you're going back in time and tracking patients from there. And then you are seeing whether they can develop disease. Any questions at this time? Is that easy enough? Please just say something in the comments. Okay. If any questions, please ask. And there are not any dumb questions or bad questions. So again, going to that hierarchy of evidence, so you see systematic reviews on the top, and then you have randomized controlled trials and cohort, and your observational studies, case reports, and expert opinions. Now, when it comes to review articles, there are three broader categories. One is narrative literature review, scoping review, and systematic review. Now, you can do systematic review with and without meta-analysis. So you don't really need to do meta-analysis if you don't have to. But if you do meta-analysis, that can be done on systematic review. Now, what's the difference between all of them? when I will give you an example. So even in scoping review too, when you ask question can be broader. In narrative literature review, question can be broader. And well, in systematic review, that can be specific. So for example, today's example that we're going to talk about ketamine and depression. So and depression can be of different types. I'm a psychiatrist, so my example is going to be coming from psychiatry. So depression can be, unipolar depression. It can be bipolar depression. It can be grief. It can be, dysthymia or persistent depressive disorder. So if I want to look at ketamine and depression, see, my question is really broad in this example. But if I want to look at ketamine and major depressive disorder, and what outcomes I'm testing for, that makes it more specific. Now, as far as the source is concerned, and we will talk about different sources, systematic reviews have more comprehensive, explicit approach. So you extract the articles from certain numbers of, let me see, is it getting recorded, right? Can someone say it? Mohsen, is it getting recorded?
Yes, it's being recorded.
Okay, so in the sources, for example, if I'm writing ketamine on depression, I can just go and get some articles from the PubMed and write a review article on that. In the systematic review, you need to pick certain number of electronic databases, and you need to go through a process of selecting studies, and we'll talk about that. So it does have a rigorous methodology. And in synthesis, whatever data do you get, it can be quantitative and qualitative. So you can also do systematic review. If you don't do meta-analysis, that is more like your qualitative analysis. But if you add meta-analysis on the top of it, that would be a quantitative analysis. In the inferences, the lessons that we take home, they are in systematic reviews. They are in systematic review. They because of its rigorous methodology, they are considered evidence-based. While in narrative literature review and scoping review, not so much. So this is why when you look at this hierarchy of evidence, systematic reviews are on the top, because these are evidence-based, they have rigorous methodology, they go through stepwise step approach. So the difference between narrative literature review and systematic review. So the rigorous methodology, critical appraisal is involved. Now, what is a systematic review? So, let me see if I have a slide set. So in systematic review, scoping reviews are more closer to systematic review. In scoping review, your question can be rather broad, and you don't have to do the quality assessment. So if you look at this slide, so you don't do the quality assessment, which is here marked by evaluation, and your question can be broader, but you still do rest of the steps of the systematic review. So scoping reviews are more closer in methodology than systematic reviews. Let me show you guys another slide set that probably has, in that I sort of highlighted the differences. Okay, it's here actually. Okay, do you see this slide set, this slide? So if you see this slide, if you see systematic review, they have a review protocol. Similarly, scoping review has one. In scoping review, you don't need to register the protocol, but everything else is about the same. Only thing is that you don't need to do risk of bias assessment, right? Which is your quality evaluation and those sorts of things. So based on this, scoping reviews are closer in methodology to systematic reviews than the regular systematic reviews. Does this answer your question, Salman? Please say yes or no. Okay. In systematic review, so this is very comprehensive definition, and it covers the different parts. And this is where we getting into the weeds of doing systematic review. It's a review of evidence on a clearly formulated question. So first thing that you need to do is you need to formulate a clear question. Then you need to use systematic and explicit methods to identify the studies, select those studies, and appraise them. By appraise, it means the quality evidence, and then extract and analyze the data that studies that are included in the systematic review. So this is also tells you what are the steps that are needed in systematic review. Meta-analysis. So meta-analysis is a pooled analysis that collects results from different studies and bring you a single estimate, right? So for example, I'm looking at efficacy of ketamine in major depressive disorder. So what it's going to do is, if I'm considering randomized controlled trial, it's going to look at all the randomized controlled trials and their numbers, and it's going to give me one effect size, how much ketamine is effective in major depressive disorder. So it pools the data from all the studies to bring into one single estimate. Okay, so this is a diagram, just like the diagram, so I just wanted to put it. So the first step in the systematic review piece is identifying a research question. So for example, I think, and why do we need this? Because it helps us, answer a question. And when you are deciding, and you will see as we design the research question, it will help us determine eligibility criteria, study screening process, and analysis. And when you're looking at, research question, it should be feasible. When you're doing any systematic review, it should be feasible. It should not be too extensive, where your team does not have expertise or the resources to take care of it. It should be novel. So for example, lithium is a treatment of choice for bipolar disorder, right? Everyone knows it. We don't need to do a systematic review on that. It should be ethical and relevant. And usually for systematic reviews, we use PICO format to formulate a research question. Now, what is PICO format? Format? Here we are getting into actually systematic review. So PICO stands for PICO, as the name suggests. So P is for patient, or population, or problem. So what is it like you're trying to address? And I is for intervention, C is for comparison, and O is for outcome. So PICO. So whenever you are designing a research question, always think about it in a format of PICO, especially if it's an intervention-based trial. There are other ways to look at that. But for simplicity today, we're just going to focus on this. So let's say we want to, so for example, we were having, we have a WhatsApp group of the psychiatrists where we were discussing the effectiveness of ketamine for depression in long term, right? And we were discussing whether it's effective or not. So that can be your systematic review. So here, let's see, we want to study effectiveness of ketamine for patients with depression, right? So this is our question. It can be anything else too. For example, effectiveness of aspirin or Plavix in prevention of future myocardial infarction, things like that. So for myself, for today, we just gonna focus on this. So broad question is the effectiveness of ketamine for depression compared to other interventions. So that's a simple question. Now, as I discussed previously, that depression can be of different types. It can be major depressive disorder, dysthymia, it can be postpartum depression, it can be grief. But to make it more narrow, we want to study, for example, effectiveness of depression, major depressive disorder compared to placebo in randomized controlled trials, okay? So you can also specify your studies, whether it has to be randomized, non-randomized, it can be open label trial. So tell me, if we look at the PICO format in the narrow version of, in this narrow question, what's the PICO, P for? So P is for patient, problem, or population. So what would represent patient population or problem in this question here. You can use chat. Okay. Anyone else? Okay. I just saw from Salman, I want everyone to participate. Salman will reach out. Okay, so that's right. So our patient problem would be patient or problem or population would be individuals with major depressive disorder, right? What would be our intervention in this case? Ketamine, okay? Anyone else disagree with both of them? Okay, good. So our P is patient, problem, or population. So that would be individuals with major depressive disorder, right? And our intervention is ketamine. What is our outcome? Outcome means what is it that we are trying to assess? So yeah, cured or not cured. Anyone else? So effectiveness is effective or not effective. That would be our outcome. What would be our comparator in this question? Placebo. Good. So this is how you construct your research question, and you can apply it to anywhere. So P is for patient with major depressive disorder. I is for intervention, which is ketamine. C is for comparator, which is placebo. O is for outcome. Now, tell me an example of another research question. It can be anything. So, anyone?
If anyone would like to speak, you guys can just raise your hands.
Okay, so I can give you other example. So for example, a primary PCI is more effective than thrombolytic therapy in patient with acute coronary syndrome. Good, really good. So primary PCI, so what is P in Rija's example? I hope I'm saying your name right. So what is the P or patient or problem or population in this patient? Patient with ACS, patient with acute coronary syndrome. Primary PCI is intervention, thrombolytic therapy is comparator, or effectiveness is outcome. Then Salman mentioned examples of aspirin effectiveness in MI compared to Plavix. So aspirin is intervention, effectiveness is outcome. Patients with MI becomes your patient population or problem, and Plavix is your competitor. So that's how you develop your research question and go from there. So some other ways to do that, here are some other examples, but we're going to stay on to Pico format today. So next step is you have a research team. In research team, you need to consider, like-minded people who don't slow you. You can add someone who has expertise, for example, in cardiology, so they can, sort of share their insight on the clinical part. If you're doing a meta-analysis, can a biostatistician can be part of your team. So it really depends on the extent of your project. So usually I don't do very extensive projects. So I usually have 6 to 8 people in my team, and it's okay, but it should not be like if you're doing a smaller systematic review, you don't need to have like 16 or 18 people. So think about steps of who will be in your team, who has the expertise. And, I started very fresh after fellowship, and, hopefully once we'll end today, you will be able to do a systematic review. It's just a matter of taking initiative. Next step is protocol registration. So like, when you are doing randomized controlled trial, there are, registries where you can submit your protocol. Protocol means that you have decided that this is going to be my methodology, this is going to be my patient population, things like that, and you submit it ahead of the time. What difference it makes? Someone tell me what's the benefit, or why do we do protocol writing at the start of the study? Anyone? Okay, let's see. Keeps everyone on the same page. That's really good answer, Kinza. That everyone knows what do we need to do and how are we going to approach. So it involves the methodological decision. It is done prior to, you start the process. So it keeps you accountable. So, and then, it prevents selective reporting. So let's say in studies, if something is not working, you cannot really go back and change it. It also structures for systematic review. It structures your systematic, your review process, right? And, and then, there are some registries where you can go and submit your protocol, and you can see if other protocols have been published, if someone else is not working on that. So you can go look into different databases. You can also look at the Prospero. So I'm going to show you guys. Let me see what does Prospero looks like. Cochrane is another one, but usually Cochrane only publishes its own systematic reviews that are done by Cochrane teams. So this is called Prospero. So you go there, you can join, and then you can join, and then you submit a systematic review protocol there. It doesn't cost you anything. It is very simple to do. Let me show you guys one systematic review protocol that we submitted there, and that was also on ketamine and on ketamine, major depressive. So this is the protocol. So what does it include? It includes review question. It includes your search strategy. It sort of talks about the problem. It gives a problem statement that why are you studying and what's the reason for that. And you see it only has to be like 4 to 6 sentences. Then it talks about your eligibility criteria. It talks about what's going to be your intervention, what's going to be your comparator group. What is it that you're studying in this group? How are you going to get data extraction, risk of bias assessment, and what will be your strategy for data synthesis if it is meta-analysis? And then rest of it is pretty simple. So usually they suggest that before you start the screening process, just at that time, you should have submitted your systematic review. And you can, look at this, and it can give you a guideline. What are things that you need to say, and what's the standard language that they use. And I will show you during this process, what are those steps that we need to include. So if you go back to our question, I just want to see if people are awake. What was our question in this systematic review? Anyone can share our effectiveness of ketamine on major depressive disorder, right? So now we want to develop an eligibility criteria. What are the studies that we need to keep? So systematic review, remember, we look at different databases and then we select articles based on that, right? So we need to develop a criteria, which studies to keep, which studies that we don't want to keep. Now, what are the inclusion criteria? So inclusion criteria is that these articles must have these elements to be included. So inclusion criteria should define nature of intervention and comparator. It should capture studies of interest and consider appropriate study design and patient population. So let's see, remembering our question, tell me what should be our inclusion criteria for this systematic review. And please be wrong. That's okay to be wrong. So think of the patient population that you want to keep. Think of study designs that you want to keep. Okay, we need to define certain age group. So which one do you want to keep? Okay, Sadaf said we need to keep RCTs. You can also have non-RCTs too, but good. So we'll only consider randomized controlled trials, right? Okay. So patient should have a diagnosis of major depressive disorder. Now, I will not put a time limit. I shown that for 5 years. Once you're diagnosed with major depressive disorder, you have a depressive disorder. Really, that does not matter. But let's say if you're discussing treatment-resistant depression, you can say that they have failed, 2 or more in type. We only going to include trials that include patients who have failed, 2 or 3 antidepressants. Okay, so for age, okay, so there should be a comparator group. You can add that, which can be placebo or treatment as usual. Okay, what else? So Salman made a good comment about age group. So for this, I will keep only patients between 18 to 75 because most randomized controlled trial that's going to be done in this, they're not going to have patients 20 to 30. So if you look at the randomized controlled trials, they're going to have patients from all the adult population, which can be 18 to 65 or 18 to 55. So any other inclusion criteria that you want to keep or add? Okay, I think we have a good start. So we're going to keep RCTs. We're going to only consider patients who have major depressive disorder diagnosed by a certain criteria. Okay, and we have a comparator. There should be a comparator group, placebo or treatment. So you can add a time duration. That's a really good question. But it really depends on what kind of evidence that exists there. So for example, lithium and bipolar disorder. So it has been in the clinical world for over 3-4 decades. So there would be a lot of studies. So in those cases, you can limit the duration. But for ketamine, it just came in. So you don't want to restrict yourself because you will have less of the studies that you will be able to do a meta-analysis. So you need to have enough studies in the group. So for this one, I would not include it, duration. But in any other studies, you can consider that depending on what's the extent of evidence that exists there. Do you guys agree with this inclusion criteria? Say yes. So you can only say that, I will consider peer-reviewed publications in this example, okay? I would not put more inclusion criteria because that's going to restrict your study. So that's your inclusion criteria. Tell me if you agree. So other people, so we have 14 people. Please say if you agree or disagree. Okay, good. So now let's look at the exclusion criteria. What are certain things that we don't need to keep? So we need to exclude studies that does not relate to nature of intervention and comparator in our studies, right? We need to exclude the studies that don't go with the study design that we discussed previously. We need to rule out any studies that may focus on patients other than our patient population. So what would be our exclusion criteria? What are the in this situation, effectiveness of major depressive disorder, ketamine versus placebo? So what would be our exclusion criteria? Yeah, I think that's a good question. That's a good example, Rija. Patients taking any other pharmacological interventions, but in this one, most of those patients will be taking someone else. But just for the sake of understanding, we can say that patients with comorbid conditions. Now here you need to be aware of the scientific world too. So 75% of patients who have major depressive disorder, they have generalized anxiety disorder. So if you exclude that, you only gonna left with very few. But for sake of our understanding, patients with depressive disorder other than MDD. Okay, what else? Can we exclude certain study designs? Right? Study designs other than RCTs. Okay. Anything else? Okay. Studies published in non-peer-reviewed publications. Yeah, that's really good. Patients who don't meet our age criteria, patient ages less than 18 and more than 65, right? Because we decided that we only going to keep 18 to 65. Another one can be, let me think of anything else. Okay, let's go with this for understanding. Now, let's go back to the protocol that we published and see how closely what we decided is related to that protocol. Okay, I just want to show you guys that it is very doable thing. So here is the eligibility criteria. Randomized controlled therapies trials focus on treatment of ketamine as primary pharmacotherapy. Studies that focus on adult population with major depressive disorder who were either screened for depression using validated screening measure or diagnostic systems, ICD or DSM were included. No restriction on race, place, age, ethnicity, language, and publication date were applied. What was our exclusion criteria? So study designs other than randomized controlled trials. Data should not be overlapping. So by overlapping, I would explain that at the end. Abstract only articles, so studies that get published in conference papers. Animal studies, so we excluded them. In vitro studies, so let's say if they're looking for some efficacy measures based on the lab things rather than filling a PHQ-9 or something like that. Now, overlapping data set is meant by, so let's say there was a randomized controlled trial that was going on, and they published the data, interim data, which is they publish on effectiveness, but they also published later on when the study was complete. So you will pick one which has complete data. So you don't pick overlapping data sets for to be included into systematic reviews. Any questions so far? I think we are doing good with time. Any questions so far? Okay. So next step in the process is, as highlighted, so overlapping data set is, for example, Salman, we did a prevalence of major depressive disorder study. We are doing a systematic review on prevalence of major depressive disorder in South Asia, right? Now, there was a study that was done on prevalence of major depressive disorder in Pakistan. That was also part of the prevalence of major depressive disorder in South Asia, the original study and a cross-sectional study. So because that data set exists in relation to Pakistan and also to the South Asia, so you keep only one. You don't keep overlapping studies. So in vitro studies, for example, in ketamine with major depressive disorder. So for example, if they look at the brain-derived neurotropic factors to see if ketamine helps with the brain-derived neurotropic factors. So because BDNF usually in treatment goes higher in patients who are getting treatment for depression. So that can be an example of in vitro studies. Does that answer your question, Rija? So you can exclude that. I think it's secondary analysis. So by secondary analysis is meant as that a randomized controlled trial has published, some data. And for example, Mohsin has done a randomized controlled trial and has published some data. And then 2 years from then, he publishes another study based on the data set that was already used. So it really depends on Mohsin, if, for example, that randomized controlled trial that originally you published data, for example, for ketamine and anxiety, and there was no talk of depression. But when you did secondary analysis on depression, because it is relevant to our topic, we can include that. Does that make sense? Okay. So now next we will go to, so far we discussed our research question. We discussed our eligibility criteria, what will be our inclusion and exclusion criteria. Next will be our search strategy. Now, so search strategy is based on research questions. And so that's where I said, research question will help you dictate your future methodology. Search strategy can include the formation of search terms that are used to identify relevant studies in major databases. And this you can, by using that example, you can search studies by using electronic measures and also doing manual measures, okay? So what are different electronic databases? So this is a screenshot from Priceline. Do you guys know Priceline? Anyone knows about hotel.com or booking.com? So for example, there is a website that holds the data. You want to book a flight, you just go to that website and you search for certain, destination, and it gives you all the flights. So for example, this is Priceline. I want to travel from Lahore, from Hartford, Connecticut to Lahore. And let's say that's what I'm doing. So now it's going to pull me all the dates. So because the date was odd, so it didn't pick anything. So it's going to give me all the flights, right? From those dates, American Airline, Qatar, UAE. So that makes my job easier. Other thing that I can do is I can go to Qatar Airline or individual airlines and I can pick the flights from there, right? But this single portal gives me access to all the, all the available options. Exactly, Rija. It gives you a comparison of here's travel estimates of different airlines, and that's how you do that. Now, for example, I'm going to give you an example, and now I'm going to relate it to this articles of ours. Now, so this article that was published in Pakistan Journal of Medical Sciences, now you will see, while I published it in Pakistan Journal of Medical Sciences, it is available in different electronic databases. So this one is PubMed. It is also at ABS co-host. It's on ResearchGate. It's on the journal website. It's on Semantic Scholars. It's on EuroPMC. So similarly, like the electronic databases, similar to like Priceline.com, electronic databases, all the articles from the different journals, they get indexed into a certain databases. So all the articles that are published, for example, in Pakistan Journal of Medical Sciences, they will go to PubMed and they will be indexed there. So you can go in PubMed, you can search and find that article. And there are numerous journals who would index their articles in, for example, PubMed. So that's why electronic databases are great. So rather than picking on different going through journal by journal, you can go to just one database and you can find all sort of articles. So for example, if I'm gonna look at ketamine for depression, I can just do that at PubMed. So I will show you. Here are different electronic databases like Cochrane, MBIS, PubMed, Scopus, Web of Science. PsycInfo is more for psychiatry articles. CINHL, SNL, that is more for nursing articles. ERIC is more for educational research. So there are some databases that are broader, like Cochrane, MBIS, PubMed, Scopus, Web of Science, that will publish all sort of articles. But there are some specific ones, such as PsycInfo, CINHL for nursing. Gray literature is something that does not get published. So you can just index it there and go from there. Now, so these are electronic databases. For purpose of systematic reviews, they ask us to pick at least 2 electronic databases. So one that is commonly picked is PubMed, and then you can pick another one. But usually when I'm doing systematic review, I go for 4 to 6 different journals, different databases. Anyone has questions about databases at this time, electronic databases? Okay, so we will cover that part, Rija. So this is your electronic search. You can also manually search the article, and I will show you how manually you can search the article. So for example, you can go to a journal website. A lot of societies publish their conference proceedings, like abstracts that were submitted there. You can do hand search. You can go there. If you know some prominent authors who work on an interest area, you can reach out to them and see if they have published something on this recently that might not be part of your search. You can also reach out, for example, to manufacturer of ketamine and see if they have published anything recently that they want you to be aware of. So that's how you do the search. And I will do this with you guys. But before we do that, we need to develop search terms. So for example, if I go to, PubMed, and I want to do search for ketamine and depression, I need to design a search term that will ensure that we pick as many articles as possible. So now it has, for example, I said ketamine and depression, it has roughly picked up 4,500 articles, but I think we need to be more specific, right? So I will show you how do we do that. So there are different concepts that we need to do. So one is the MASH term. So MASH is a comprehensive controlled vocabulary for the purpose of indexing journal articles and books in life sciences. I think the definition is very confusing. So let me show you what is meant by MASH terms. So MASH terms is, for example, if you pick term MASH for depression and you add MASH right next to it, it's gonna pick everything that comes in these search so depression, depressive disorder, long-term synaptic depression. So anything that is related to depression, that will be, if you pick MASH, it's gonna show you different search terms that can come under depression. But I keep it very simple. Another thing that you need to know about is Boolean operators. And this is very simple. It may seem difficult. So there are 3 Boolean operators, and are not, okay? So for example, so we wanna do, we wanna look for ketamine in major depressive disorder and randomized controlled trials compared to placebo. So I definitely want ketamine, right, in my search term. I want something related to depression and randomized controlled trial. Now, so there are 3 main concepts. Now for ketamine, I cannot think of another word that would be alternative, but what are different other words that can be alternative for word depression? Anyone? So MDD, or you can say major depressive disorder, because you don't know which articles will use which term. What else? It can be depressive disorder. You can add that too. Now, for randomized controlled trial, you can add trial. You can add randomized controlled trial, because different articles will use different terms. So you need to make sure that you pick the terms that ensures that you get comprehensive search. So this is ketamine. When I use R, so when, for example, if I combine all of this together, ketamine, when I use and I add depression to that, so it's going to pick all the articles that's going to have the word ketamine and depression, okay? So let's say if I say depressive disorder or major depressive disorder, so now it's going to pick all the articles that has ketamine and depression, and in depression, it's going to pick everything that has depressive disorder, depression, or major depressive disorder. Okay, now what if I change it a little bit? I say major depression or major depressive disorder, and I use a Boolean operator here, not. So it's going to exclude it's going to pick the articles for ketamine and depression or major depressive disorder, but it's going to exclude any articles that would have bipolar disorder in the terms in the article. Is that clear? So and is something that would pick, if you use it, it's going to pick both of these terms in an article. If you say R, it's going to pick the variation, like it's going to pick the trial, randomized controlled trial, and controlled trial. If you use not, it's not going to pick anything that is related to bipolar disorder. So these are called Boolean operators. Now, there is one, when you add steric, it can pick the variation. So what can be different variations? So let's say if I put an steric there, that's called tronication. So it's going to pick all the variations of depression that will start off with this. And what can be that? Anyone? So that can be depression. What else? It can be depressive disorder. Since you guys probably don't know, I'm going to add that. It can be. So for that, yeah, it can pick postpartum depression too, because you're picking for depression. So that's called this static sign. That's called tronication. Okay. Yeah, it means when you pick depression, it's going to pick all sorts of depression. There is also another term that is called wildcard. So wildcard means, like, for example, you can define behavior like this. You can also say behavioral, right? So if you use a wildcard here, which means that you add a positive sign here, and say this is going to pick all the variations in the spellings too, because there's a difference between, American English and European English. So you want to pick that. So these are your Boolean operators. And let's pick, for our study, let's pick the search terms. So give me the search terms that you want to pick. And it can be totally wrong. Yeah, I think probably they work on most of databases. So let's decide our search term. So we are studying effectiveness of ketamine in major depressive disorder compared to placebo in randomized controlled trials. So what would be our search terms? Anyone? That's good. So ketamine and because we want to pick another one. So for depression, we're going to add depression, depressive, or major depressive disorder. So I would not add placebo here because, you know, then it's going to start picking all the studies that would have placebo as part of it, and it might not be related to ketamine. What I will also do is I will add the study design. So randomized controlled trials or CT or controlled trials. So this is our search term. Do you guys agree with that, or you guys want me to change it a little bit? Anyone? Okay, you guys agree with that. Anyone disagree with me? Okay. So let's go and so what we're gonna do is so because you know Rija, let's say if I use ketamine and placebo, and it does not work completely perfectly, you know, so what it's going to do is it's going to pick all the studies that may have placebo and that might not be related to ketamine. So you need to be as specific as possible in picking that. So I would not suggest you picking up placebo, but you can certainly do that. But, you know, most people will say you don't need to pick for placebo. So you have your, you know, intervention, you have your study design, and you have your patient population. Just stick with that. Now, let's see. So this is what yeah, you can have SSRIs if they have compared ketamine to SSRIs, things like that. So now what I'm going to do is I'm going to pick this search term and I'm going to go and search in PubMed. So I just enter here. So previously when we looked, it showed me 4,500 patient, you know, results when I just had ketamine depression. But when I made it more specific, now I only have 1,350 articles, right? Now, so here is 1,350 articles. So this is PubMed. I want to use 4 electronic databases. So I'm going to use, let me see if I have still the link open for. Okay. So this is, let me see if I can go back. So this is PsycInfo. In PsycInfo, you can go on basic search. I pick here, click here, I search. So if it also, you know, has psych articles and PsycInfo. So in psych articles, so psych articles is paid. You should have access to that. So I'm just going to go with PsycInfo, which has 3 articles that are indexed there. Okay. And so I have 1,350 on PubMed, 3 on PsycInfo. Now, Mohsen's going to show you how to look for these in Scopus and Web of Science, and then we'll show you how to bring it together. Go ahead.
Am I audible? Everyone, if you could please
yeah,
type in the chat section. Okay. So here we have our search term, and this is how Scopus. Okay, cool. So this is the main page of the Scopus. Here we can search for documents, author, and research discovery. On the left side, this tells us which part of the article or which affiliation funding you want to screen. Here you can put the search term and you can hit the search button, or what else you can do is you can add the search field, and maybe you can write ketamine here or randomized control trials in here, and you can write depressive disorder with this and variable integrated into the database. If you hit the search button, it will give you, yes, it has almost 2,200 articles in it.
Yeah, so it has given us 2,200 articles on Scopus. Okay.
Yes.
Can you show us on Web of Science now?
Sure. So this is our Web of Science. Research in all fields. It gives us almost 1,500 articles.
So 1,500 articles. Now, Mohsen, I'm going to take control back from you. If you can send me those EndNote files on WhatsApp.
Okay.
Okay. So until now, we are searching for, 4 electronic databases: PubMed, Scopus, Web of Science, and PsycInfo, just for the psych articles, just for the example. Now, what I'm going to do is, so generally what I do is when I go to, I use Google Scholar, Google Drive a whole lot to store my data and things like that. So let me see if there are questions. So, Soman, you just need to go into, the first section is which part of the article you want those search terms to be searched for. So you can always pick for title and abstract, and that's more than enough. And then just paste your search terms there, do the search, and it's going to show you that. Okay. So now, in systematic review is more about organization. So here I have the date of search. So if we are doing it today, I'm going to say June 30th, 2023. I write my search terms. In Scopus, in PubMed, there are 1,300 articles. In Web of Science, let's say there were 1,500. Here, there were 2,400 articles. Okay. So the total would be roughly about, let's say, 500 articles. Now, that's where we go back to Rija's article, how we put all of this together where we can actually do the screening process. Because it's really hard to put everything together and there might be a lot of duplicates. So for that purpose, we use EndNote. So EndNote is a referencing management software. So let me go back and pull those articles from the PubMed. So when you have that search, like you search here, you click on the send to, you go to the citation manager, click on this. And when you go there, say all results, because if you say all results on this page, it's going to only pick you 10 or 12 for you, but you need to say all results. You go to click on the create file. So it has sent, a download file for me in the EndNote format. Now, so I search the terms. I want you to tell me the steps that I need to do to get to the EndNote. So which one I need to click here? So I did the search. Then I did the send to. What would be next? Anyone? So I will go to the citation manager. Which option should I pick? All results. And then I'm going to send it to here. So it's going to send me an EndNote file for PubMed. So I'm just going to save it here in my desktop. Then, so we are done with this part. Any questions on how to import from PubMed to EndNote? Is that easy enough? Please say yes or no. Okay. Now, let me go from PsycInfo. So here, you say, here first I'm going to pick all. Then I click on the export. I'll say all records on this page. And then you click among reference software. And then I'm going to say EndNote desktop because I have it on my desktop. When I click that, I hit go. I get a pop-up block, but I'm just going to click on that. So I got a PsycInfo, psych articles file here that I'm going to download on my on my desktop. So what do I need to, let's see. Now you guys walk me through the steps. Which one I need to pick first? All, click all, then I click here, it's called export. I say all records on page, then what next? So select my software, which one I'm gonna pick. EndNote, if I'm working in EndNote. Then go. So it's gonna download this for me. So now Mohsen also has sent me his, so let me get that. So so now we have roughly about 5,500 articles that we need to bring together for the screening. Sorry, there is a, okay. Now I'm gonna open up EndNote. Where did that go? Okay, I think I messed it up. Okay, let me find my EndNote. I'm gonna unshare screen so it becomes easier for me. Let me see, where is my application? So I'm gonna go through it in an orthodox way.
Dr. Naveed, can you share the screen so I can probably help you out?
Yeah,